now, I am so excited for our closing session keynote speakers, Maria Smilios and Virginia Allen. Maria is the author of the book, The Black Angels, the untold story of the nurses who helped cure tuberculosis. Set in New York City and beginning of the Great Depression, Maria's book is the story of the tuberculosis epidemic and of the black nurses at Seaview Hospital in New York who cared for tuberculosis patients. These young nurses, called the Black Angels, labored to care for their patients when a cure for the disease was unavailable and the available treatments were uncertain and frequently dangerous. First, Maria will provide some remarks, and then the last surviving Black Angel, Virginia Allen, will join us. Please join me first in welcoming Maria Smilios.
Good afternoon. Thank you to the AANP and the Board of Directors for inviting me. My name is Maria Smilios, and I am the author of the book, The Black Angels, the untold story of the nurses who helped cure tuberculosis. I am honored and delighted to be here as your time in Nashville comes to a close. Today, I want to share a story with you. It's about an exceptional group of women whose narrative is as relevant now as it was 100 years ago. My hope is that in hearing it, it will empower, uplift, enrich, challenge, and inspire you in your professional life and beyond. But first, a quick aside. I am not a nurse, but in my personal life and over the last 8 years, I've spent a lot of time with nurses who, in my opinion, embody what it means to be human, what it means to sometimes do impossible things. My first prolonged experience with nurses came in my early 20s when my mother was dying of cancer. Day after day, they not only looked after her, but also me and my younger brother. They asked me about school, my friends, and life outside of the room where a wicked disease was killing the person I loved most. They assured me that every time I left the hospital and later hospice, they would care for my mom with dignity, compassion, and grace. They didn't lie. And to this day, almost 35 years later, I still remember them and how they kept me going. My second encounter came in graduate school, where I was studying literature and religion, death and dying. I had volunteered at Boston Children's on the bone marrow transplant unit. Every Monday for years, while I sat with the kids, I saw the nurses, how they entered each room, and once they stepped in, the world outside fell away. I watched how they slipped between the myriad IV stands that surrounded the bed like resolute soldiers, how their hands seemed to dance between the buttons and tubes, moving one this way and another that, how easily they switched out bags of fluids and medications, all the while keeping an eye on their patient. It was in those rooms where death was palpable that I realized nursing is a science, an art, that to keep someone comfortable, alive, requires a mental and emotional steadfastness, a skill, an acumen most of us can't ever imagine. I stand in awe of what you do at that daily choreography so necessary to save lives. If my 6th grade science teacher had not told me that I had a, quote, girl brain, and girl brains don't do science, he said, they study poetry and get married, I might have become an oncology nurse. But instead, I became an author, which, in a strange serendipitous twist, led me to my third encounter with nurses, one that took me deep into the history of this noble and storied profession and introduced me to the remarkable women who, one of them you will meet. On a languid day in August 2015, while working as a science editor for Springer, I was editing a chapter on rare lung diseases, and I read a line, actually 13 words. The cure for tuberculosis was found at Seaview Hospital in Staten Island. Curiosity compelled me to put down the manuscript and start Googling, TB, cure plus Seaview. And up came an article about the cure, but tucked alongside of it was another article about a woman named Miss Virginia Allen. She belonged to a cadre of Black nurses called the Black Angels. In late 1929, they were called up from the Jim Crow South to avert a public health crisis set off by white nurses who for various reasons began quitting Seaview Hospital, New York's largest municipal sanatorium. The story, I learned, had been cast aside, forgotten, relegated as insignificant, but I fell in love with its possibility and became determined to tell it, despite there not being a single archive. Instead, what existed was a lot of lore and family memories, all messily remembered. It would take me almost 10 years to create order from the often chaotic world of memory, and many times I wanted to quit. In those moments, I needed to remind myself of why I was writing, to give voice to these silenced people, the patients who were seen as, quote, immoral, uncouth, and unworthy of decent care, or any care at all, because they had tuberculosis. And the nurses, who because of their skin color, were also seen as unworthy. On this literary journey into the world of nursing, I came to realize how the rigor of researching and writing an oral history in many ways aligned with the demands of your profession. You too are asked to step into the heart of people's lives, to turn toward them, to gain their trust, and to listen with all your senses. You are asked to read the pauses, the body language, the eyes that look beyond you, the words that make one choke, and also to sit in the silence. It's uncomfortable and hard, but as you know, silence often speaks volumes. In talking to the families, I heard the silence in the words, the harrowing stories about mothers, grandmothers, aunts, and sisters who worked at Seaview with one of the world's deadliest diseases during one of the most dreadful times in human history, the pre-antibiotic days of the Great Depression that unfolded alongside a country entrenched in the virulency of Jim Crow. I heard of dreams deferred for years. For patients, the fault was illness. For the nurses, it was the sickness of racism. I heard about their dreams of owning homes, of becoming part of America's middle class by having a professional career. But those dreams were thwarted because the same country that drew lines around water fountains and bus stations also drew them around hospitals and homes. I also heard how these women didn't give up, how Edna Sutton Ballard and Masuria Luvino, Meadows Walker, Nellie Mae Holmes, and Clemmy Phillips, and so many others were determined to rise above the math that said Black women can't have professional careers or own homes. I heard how the burning desire to heed their calling of caring for those who were left to die and to live a life free from the daily constraints of segregation roused them. These were the yearnings that led them to the wards of a tuberculosis sanatorium, which they believed was their ticket to freedom. But the cost was high. Upon arriving, they found themselves on an isolated hilltop in the remote borough of Staten Island, yet again confronting racism, except now it was in a woefully understaffed northern hospital dubbed, quote, the pest house, where it was said no one left alive. There they watched a beautifully rendered microbe designed to torture and kill slowly, obliterate people. One patient told me the hearses arrived daily by the dozens, he said, to take away the bodies that the nurses cleaned and bathed, then mourned and shrouded. Still, they were not deterred. They showed up and fought the status quo that wanted them to fail and their patients to die. They did it by banding together. They may have arrived alone, but once at Seaview, they became a collective because they understood that nursing was not a solitary endeavor, that cooperation and teamwork, sharing knowledge and resources like you have all done these past few days could move mountains. This is a story about many things, but at its heart, it's about people working together, especially in a world that is rife with division. It's about seeing the long game, and while working towards something greater, being there for each other, lifting each other up, and remembering there is strength in numbers. Together, these nurses fought against redlining. They advocated for equal pay and equal rights, for the desegregation of the New York City hospital system, but mostly for the rights of their patients, whose dignity they restored. They worked long hours, and their days were filled with interminable challenges, an unyielding supervisor who refused to let them mask, an unending shortage of staff and supplies, and no medications to alleviate the anguish of people who were grievously ill and depressed and in chronic pain. But they showed up every day and worked as if nothing was wrong, innovating when necessary while remaining focused, attuned to the task at hand. They nursed with empathy and acuity. They did it because it was their job, because they had committed themselves to saving lives at the risk of their own. As the families told me, for these nurses, there was nothing more rewarding than showing up in the world and caring for other people, no matter how difficult it was or how long the day stretched out. At Seaview, the day often bled into the night, where the nurses were tasked to sit with the dying and watch as TB exacted its price. I've heard from contemporary nurses, both in person and through the daily emails I receive, that these are challenging times. And from what they've told me, some of these challenges reach back decades, but all of you have the power to change things, to ensure that history stops repeating itself. As I've come to see, nurses are some of the most tenacious and committed advocates, especially for their patients. You can make sure no one is ever villainized, stigmatized, turned into the sum of their illness because they are sick or destitute or come from another country, or because they believe in a different God or no God at all, or they go by a different pronoun, or they can't afford health care. You can use your voices to change things and ensure that we live in a world where good health care isn't seen as a privilege, but as a given, a human right. But all of you know this kind of change takes patience. We live in a world of immediate gratification, of clicks and likes and computers that do things faster and sometimes smarter. They save us time. What the Seaview nurses understood was that nothing happened overnight or linearly. Even the most important change happens in fits and starts, and it's often marked by irrationality, as the nurses witnessed time and again with failed medications and failed policy. For instance, in the 1930s New York City, the health department thought it could control the spread of tuberculosis by deploying Choo-Choo, a health clown, and his sidekick, Cremo, a tiny terrier, into the slums to sing ditties about bathing and drinking milk to parents and kids. It failed. And those in power were finally forced to look at the real cause of tuberculosis: poverty, racism, stigma, and inhumane living conditions. Nowadays, we may not have health clowns like Choo-Choo, but we certainly have our fair share of the irrational. When you encounter it, whether in your patients or institution or the outside world, remember these women, and like them, reach for patience. It will embolden you, and in time, it will yield results. They saw the results. And take care of your well-being. Despite the hurdles the Seaview nurses faced, they still found time to unwind. They went to baseball games, danced in Harlem, hosted dinner parties. They fished, played cards, and as one family member told me, they always found time to laugh. And no matter how life unfolded, they remembered it was a gift, and to be alive was a beautiful thing. Take a moment each day and, like them, find the wonder in the world, especially in the sick you are tasked to take care for, because you never know where that might lead. For these nurses, their road, paved with the same routine day after day, ultimately led to triumph, to becoming part of a galvanizing moment in history, the cure for tuberculosis. It was a 1 in a million moment. I hope they embolden you to show up each day as if it's your 1 in a million moment, to be present, empathetic, and even if you're not involved in a world-changing historical event like the Black Angels, or those who worked on the front lines during COVID, remember, you're always part of someone's narrative, and your work for them is life-changing. Lastly, please remember that history matters. Your history matters. At this conference, you have been graced with 2 women who are part of nursing's great history. Dr. Loretta Ford, who I had the honor of meeting yesterday, and whose presence at 103 is a testament to her pioneering spirit that forged this organization, the AANP. In a moment, you'll meet Miss Virginia Allen, another trailblazing woman, an honorary NP, who I've known for 9 years. She will share with you her experience of working at Seaview. The presence of these 2 women is profound. Their stories and their wisdom is moving and empowering, and as one reviewer said of the Black Angels, and I'll add, any person who shares their lived experience, it is this: they give us the choice to be better now and in the future, and right the wrongs that still plague us. I've come to believe that if anyone can enact change, especially with this broken healthcare system, it will be nurses. You are the backbone of healthcare. No hospital or facility can function without a nurse. That is the truth regardless of what anyone says. In the end, the story of the Black Angels is heartbreaking and sometimes infuriating, but it is ultimately a story of triumph, of humanity, one that reminds us there will always be people like you who selflessly commit themselves to working on the front lines of healthcare. It is also a story of will and the determination to make the world a place where equity, compassion, and love are the guiding principles. Thank you for your service. And now I'd like to reintroduce Dr. Ferreira and Miss Virginia Allen, one of the last surviving Black Angels.
Amazing story, just amazing. We'll start out with you, Miss Virginia Allen. How does it feel to be part of a legacy that not only saved lives, but also broke racial and gender barriers in healthcare?
I feel honored to be here this afternoon. Thank you so much for inviting me. I feel honored that I'm still here and able to represent those more than 300 nurses who worked at Seaview Hospital.
Absolutely.
And gave so much of themselves.
We're grateful for you to be here today. We truly are. Thank you. For Maria, what impact do you hope Black Angels will have on the current and future generations of healthcare professionals, especially nurse practitioners?
As I mentioned, I hope when people read the story, they feel inspired and empowered. I hope that the history resonates and that they want to go out and enact change. So as I said, history doesn't repeat itself and we move forward instead of moving backwards.
Thank you. Virginia, what are some of the key lessons you learned from your experience that you believe are still relevant today for nurses and nurse practitioners?
Thanks to the wonderful nurses I work with and the training that I received at Seaview Hospital, I am still capable and able to be here with you. Isolation technique was very important then, as it was during COVID, to protect the nurses and staff from, as much as possible in those days, from getting tuberculosis. And of course, the vaccine with COVID. But I'm happy to still be here.
Absolutely. Thank you. Speaking of COVID, Maria, in writing Black Angels, did you encounter any parallels between the challenges faced by these nurses and those faced by healthcare workers during the COVID-19 pandemic?
That is a great question. It's a loaded one, and it could take me hours to answer it. But in a nutshell, I experienced COVID in New York City at Ground Zero. I was a mile from Elmhurst Hospital, where those pictures of nurses wearing garbage bags because they ran out of protective equipment graced everyone's television set. I would leave my house, and I saw the morgue trucks, and I saw the lines snaking around the hospital. I'm the daughter of immigrants. I grew up about 2 miles from that area, and that is a heavily populated immigrant area. As I mentioned, well, actually I didn't mention in my talk, most of the patients at Seaview Hospital were African Americans and immigrants. They had come from Europe. And so when COVID hit, I had a manuscript finished. And once that happened, I realized that manuscript was no more. And one day I left the house, and it struck me that this is really a book about who lives and who dies based on the zip code in which you live. And the parallels were so uncanny as to who was called to the front lines and who was waiting around, the line snaked around the block, and who was waiting to get care. And so I rewrote the entire book with that as the sort of heartbeat of the book. So there are so many parallels, but that was really the one that struck me the most.
Thank you. Virginia, were there moments when you when you felt afraid or overwhelmed by the challenges you faced?
Certainly. Tuberculosis was a very deadly disease. And there were many challenges, unfortunately. Many of us got ill. Some died. But I'm glad that I'm able to be here with us, with you.
Absolutely. And how were you motivated to come back to work the next day when you knew you had colleagues, friends that were sick from tuberculosis?
Well, I had a job to do. I work with children, and they were delightful. It was an enjoyable experience working with the children.
Absolutely.
They gave me hope.
Thank you. Virginia, can you share some of the readers' reactions to the Black Angels book that you've heard from and how it's impacted you?
Well, it certainly impacted me, and I thank you, Maria, for writing such a beautiful book.
Welcome.
A book that describes really what happened during those early days. It has opened a new field for me in my declining years. I have traveled quite a bit. The notoriety on Staten Island is quite robust. And we have a new exhibit at the Staten Island Museum, Taking Care, which coincided with the book. It's about healthcare workers, and the Black Angels are featured. And it's been quite revealing, and it's the book itself is being discussed a lot, and the descendants who are written about in the book. So if you're ever in New York,
Road
come
trip.
to Staten Island to see this wonderful exhibition. It's worthwhile seeing.
Maria, is there anything you'd like to share with us regarding your experience and the reaction from people who've read the book?
I have been so blessed to have found this story quite by accident. Because as I said, it was a line in a book. I feel so grateful to Virginia and all of the families who have allowed me into their lives for years and years and years and years. It took 8 years to write this book. They were so gracious with their time, answering hundreds of questions that I had. People like it. The reviews have been wonderful. I thank the nursing community as a whole for embracing it. People in global health. I am so, every day, almost every day, I get emails from nurses who thank me and talk to me about the book. So I am grateful that it's making its way into nursing history.
Absolutely. I've heard Maria being interviewed on, I think it was NPR. There was somewhere, but there's a lot of press on it, and I highly encourage everybody to read the book, number one, and to listen to all the great buzz that's out there. It's truly amazing. Virginia, is there anything else you'd like to share with us?
I would like to recite a poem.
Please.
To the legacy of the Black Angels who've gone on before us. This poem is called We Remember Them, and it is also in the exhibit by Stephen Kamens and Rabbi Jack Reamer. At the rising sun and at its going down, we remember them. At the blowing of the wind and in the chill of winter, we remember them. At the opening of the buds and in the rebirth of the spring, we remember them. At the blueness of the skies and in the warmth of summer, we remember them. At the rustling of the leaves and in the beauty of the autumn, we remember them. In the beginning of the year and when it ends, we remember them. And as long as we live, they too will live, for they are now a part of us as we remember them. When we are weary and in need of strength, we remember them. When we are lost and sick at heart, we remember them. When we have decisions that are difficult to make, we remember them. When we have joy we crave to share, we remember them. When we have achievements that are based on theirs, we remember them. For as long as we live, they too will live, for they are now a part of us as we remember them. Thank you.
Miss Virginia Allen, Maria Smilios, thank you so much. Thank you for sharing your stories with us. And that will end our closing general session. I want to express my deepest gratitude to each and every one of you and your unwavering dedication, your tireless commitment, and your steadfast support of the American Association of Nurse Practitioners. I look forward to seeing you all at the 2024 Fall Conference in Reno, Nevada in September. Safe travels to wherever you live, and thank you again so much. Thank you.